Summer brings outdoor recreation, festivals, barbecues, and travel. Activities that increase social contact and exposure to unfamiliar environments. Warm temperatures and elevated humidity create conditions in which many bacteria, viruses, fungi, and parasites survive or multiply more readily. This seasonal shift changes transmission dynamics for common pathogens such as norovirus, Escherichia coli, Salmonella, Staphylococcus aureus, Cryptosporidium and Giardia. At the same time, crowded venues and shared facilities amplify opportunities for person-to-person or surface-mediated spread. From an epidemiological perspective, summer outbreaks often reflect a combination of environmental suitability for microbes, human behavior, shared food preparation, communal toilets, crowded sleeping arrangements, and lapses in basic hygiene. Research and surveillance consistently show that effective hand hygiene is one of the easiest, cheapest, and most reliable interventions to reduce infections. Public health agencies, including the U.S. Centers for Disease Control and Prevention and the World Health Organization, emphasize hand washing as a frontline preventive measure in both community and healthcare settings. Public restrooms and shared toilets. Outdoor events, service stations, beaches, and campsites rely heavily on shared toilet facilities. These high-traffic areas are well-documented reservoirs for bacteria, for example, E. coli and S. aureus, and viruses such as norovirus and seasonal influenza. Even respiratory pathogens including coronaviruses can persist on poorly cleaned surfaces or in inadequately ventilated spaces. A 2025 study reported that nearly half of hospital visitors did not wash their hands after using restrooms despite clear reminders. When using public toilets, wash hands thoroughly with soap and clean running water. If hands are visibly dirty, hand sanitizer alone is not sufficient. Outdoor eating and food preparation. Barbecues, picnics, and potlucks are summer staples but also prime conditions for foodborne disease. Warm ambient temperatures accelerate the growth of pathogens such as Salmonella, E. coli, Bacillus cereus, and S. aureus. Common risk factors include undercooked meat, contaminated utensils, and leaving perishable food in the sun. Fungi like Aspergillus can also colonize food and produce mycotoxins, toxic metabolites that cause acute symptoms such as nausea and longer-term organ damage. Wash hands before and after handling raw food and after touching shared surfaces like picnic tables, grill tools, and coolers. Avoid cross-contamination by using separate utensils and plates for raw and cooked items. Swimming, water play, and waterborne pathogens. Lakes, rivers, swimming pools, and coastal waters can carry bacteria and parasites. Cryptosporidium and Giardia are notable because they often resist standard chlorination in pools and can cause prolonged gastrointestinal illness. Beach sand and seawater may also contain fecal bacteria after runoff or sewage contamination events. Whether you are swimming, paddling, or building sandcastles, wash or sanitize hands before eating or touching your face and shower after water activities where practical. Camps, playgrounds, and festivals. Group settings where children congregate, summer camps, playgrounds, and soft play centers, have a long track record of outbreaks. A multi-year U.S. review identified hundreds of youth camp-associated gastroenteritis outbreaks caused by agents such as norovirus, Salmonella, and Shiga toxin-producing E. coli, a severe strain that can lead to kidney complications. Shared sleeping quarters, communal food handling, and limited on-site sanitation make rigorous hand hygiene especially important in these environments. How science studies and interventions work. Mission, methods, and discoveries. Field studies and laboratory investigations together produce the evidence base for hygiene guidance. Outbreak response teams typically use environmental swabs, stool sampling, culture methods, polymerase chain reaction, and increasingly whole genome sequencing and metagenomics to identify causative agents and transmission routes. Intervention trials and observational studies then test the effectiveness of hand-washing campaigns, portable hand-washing stations, and alcohol-based hand rubs. Key findings across multiple studies include consistent reductions in diarrheal illness and respiratory infections when hand hygiene is improved. Estimates vary by setting, but pooled analyses indicate hand washing can reduce diarrheal disease incidence by roughly 30% and lower respiratory infections by about 20% in community contexts. Technology and infrastructure also matter. Well-designed portable hand-washing units, soap dispensers, sensor-driven hygiene stations, and waste management at large events significantly reduce infection risk. Quote, the CDC recommends wash your hands with soap and water for at least 20 seconds and advises using an alcohol-based hand sanitizer with at least 60% alcohol when soap and water are not available. These operational recommendations are integral to public health responses during seasonal spikes and event planning. Related technologies and future prospects. Emerging approaches to reduce seasonal infection risk include UV surface disinfection, antimicrobial surface coatings for high-touch areas, improved wastewater surveillance for early detection of enteric pathogens, and smart dispensers that monitor hand-washing compliance. Lessons from closed environment hygiene, for example, maritime settings and spacecraft, inform best practices for sanitation in austere field conditions. Planetary protection protocols used in space missions underline the importance of preventing microbial contamination in any confined or sensitive environment. Portable, solar-powered hand-washing stations and compact, high-efficiency alcohol rubs are practical innovations for festivals, campsites, and remote beaches. Practical checklist. Simple steps to protect yourself and others. Wash hands with soap and clean running water for at least 20 seconds before eating, after using the toilet, after swimming, and after touching communal surfaces. Carry an alcohol-based hand sanitizer with minimum 60% alcohol for times when soap and water are unavailable. Dry hands fully. Damp hands transfer microbes more readily than dry hands. Keep raw and cooked foods separate and avoid leaving perishables in warm conditions. Use dedicated utensils and plates for raw meat and clean shared surfaces frequently. Conclusion. Summer conditions amplify the environmental and social factors that drive transmission of a wide range of pathogens. Hand washing remains one of the most effective, low-cost interventions to reduce that risk. Scientific surveillance and outbreak investigations repeatedly demonstrate that routine hand hygiene, washing with soap and water for at least 20 seconds and using 60% plus alcohol sanitizer when needed, lowers the incidence of gastrointestinal and respiratory infections. Practical measures supported by targeted technologies and better event infrastructure can make summer activities safer without sacrificing enjoyment. Whether you are at a campsite, a beach, a festival, or simply eating outdoors, prioritizing basic hand hygiene protects you and the communities you share summer with.